Earlier today, we spoke to an intern doctor who has just completed 4 months at a county COVID-19 facility and has instead decided to now take up an offer at a private hospital because, in her own words, and I quote, "I studied medicine to save lives and not to lose my own," end quote. Now, for this next interview, we concealed her identity as per her request, and I began by asking her what her experience was like as an intern doctor who experienced, in her own words, a pay delay of up to 3 months.
I was promised a fully equipped isolation unit. I was promised I'd get paid. I was promised I would be supported. I was promised my patients would have oxygen. I was promised if I sent for results, I'd get timely results back. Month 3 comes. At this point, I'm very unhappy. I sent my application to a different hospital. At this point, I have COVID experience, yeah? So I'm somehow marketable. I have dealt with harder situations. I got an interview. I did the interview. So I had to balance. Should I keep the government job that doesn't pay me? Should I keep the government job where I literally witness death instead of treating the sick? Versus the other job where someone cares, there's medical insurance, I have better equipment, there's more staff. I am promised that I will be paid at the end of the month. So by the end of month 3, I felt a little ill. I had a sore throat, some bit of headache, slight cough, a few bouts of vomiting. So I did the COVID test. So results take forever to come out, yeah? 1 week later, I'm feeling a little better. The person in charge of results calls me. He's like, "Daktari, do you know your results are out? You tested positive for COVID." It was very, very depressing to even just hear it. So I start my isolation. This is on the 7th. So I isolate for 7 days. I know I can't even send for my repeat test because it'll take 7 more days to get results. So for starters, as COVID doctors, we are exposed to higher viral loads. So higher viral loads, more severe infection. The worst thing that can happen is a reinfection. So you already have injured lungs. You don't want to injure them any further. I would like the government, and specifically the Kenyan president, because he's been very quiet, to think about forming a health service commission where all these things can be addressed. Because in the counties, we're being bullied, we're being harassed, we're being intimidated, we're being fired, we're being given short contracts. Because for most of the COVID doctors, we got the contract for 6 months. Who knows when COVID is going to end? We want the vaccine. We want access. We want to actually treat and help the Kenyan people and help ourselves.